How to interpret your pap smear results. Imagine your pap smear as a health check for your cervix, catching any early signs of trouble before symptoms even appear. Understanding what your results mean can help you stay on top of your reproductive health. When your doctor reviews your pap test, they look at the cells collected from your cervix under a microscope. The results fall into different categories, each indicating a different level of concern and next steps. If your result is normal, it means no abnormal cells were found. This is good news and suggests your cervix looks healthy. Usually, you can continue with routine screening as your healthcare provider recommends, often every 3 years for most women. A normal result doesn't mean you don't need future tests, but it does mean no immediate action is necessary. Sometimes, the results show something called atypical squamous cells of undetermined significance, or ASC-US. This means some cervical cells look slightly abnormal, but it's unclear if it's due to infection, inflammation, or precancerous changes. Usually, your doctor will recommend an HPV test to check for high-risk types linked to cervical cancer. If the HPV test is negative, you'll likely return to routine screening. If it's positive, further evaluation like a colposcopy might be needed to look closer at your cervix. Another common finding is low-grade squamous intraepithelial lesion, or LSIL. This indicates mild abnormalities often caused by HPV infection. Many LSIL cases resolve on their own without treatment, but your doctor may suggest follow-up tests or a colposcopy to monitor the situation. If the abnormality persists, treatment might be necessary to prevent progression. High-grade squamous intraepithelial lesion, or HSIL, points to more serious abnormalities that are more likely to develop into cervical cancer if left untreated. This result usually requires prompt follow-up with a colposcopy and possibly a biopsy to determine the extent of abnormal cells. Early intervention can prevent the development of cancer. If your results show atypical glandular cells, or AGC, it means there are abnormal cells from the glandular tissue of your cervix or uterus. These findings often requiring additional diagnostic procedures because they can be associated with precancerous or cancerous conditions. It's important to follow your doctor's advice closely in these cases. In rare cases, the results may indicate the presence of cancerous cells, such as squamous cell carcinoma or adenocarcinoma. If this happens, your healthcare team will refer you to specialists for further testing and treatment planning. Early diagnosis is key to managing these conditions effectively. It's also common for your healthcare provider to perform HPV testing alongside or after your pap smear. This test detects high-risk HPV types that are responsible for most cervical cancers. A positive HPV test with abnormal pap results increases the need for further evaluation, like a colposcopy. Depending on your results, your doctor might recommend repeat pap tests, HPV testing, colposcopy, or biopsy. These follow-up steps are essential for catching any issues early and ensuring appropriate treatment if needed. Screening guidelines generally recommend starting at age 21 and having a pap test every 3 years. From age 30 to 65, options include a pap test every 3 years, HPV testing every 5 years, or both tests combined every 5 years. After age 65, if your previous results have been consistently normal, screening may be stopped. Remember, pap smears are designed to detect precancerous changes early, giving you the chance to treat issues before they develop into cancer. Regular screening is your best tool for prevention and early detection. Always discuss your results with your healthcare provider to understand what they mean for your individual health and to determine the best follow-up plan. Never ignore abnormal results or delay seeking medical advice. Your health and peace of mind depend on staying informed and proactive.